The learning environment can affect how our students learn, and sometimes it can be a distraction. Students can choose other students that may not be in the best interest of them being successful in the class, and sometimes it's hard for them to separate themselves. We want to talk about today in this snapshot what are some of those priorities that we want to help our students really understand that can directly contribute to their ability to be successful in the nursing program. Students have a lot of competing priorities, and that's not new. We know that for each of us that have been in nursing school, it is a challenge. And so we have to help our students identify how they prioritize the competing priorities that they have so that they can achieve success in the nursing program. Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurse educators on the journey to achieve certification. And for some colleagues that may be joining us, you are a nurse and you're thinking about becoming a nurse manager, a nurse leader, a nurse educator. So whoever's watching us, first of all, thank you for joining us. And then second of all, we want you to be very clear about your path. Make sure you print out the study worksheet that is listed right here in the description. This is going to help you stay focused for the 10-15 minutes or so that we're going to spend together. The second step is if you are on the journey for C&E, we want you to make sure you purchase our Bible, okay, which is Teaching and Nursing by Billings and Halstead. We call this the Bible in nursing education because it truly does help guide our teaching strategies and help us go deeper as we explore ways to engage our learners. Specifically with our adult learners, we know that it can be hard to get their attention for 10 minutes sometimes, let alone for an hour. We have to think about innovative, creative, yet purposeful ways to engage our students on this learning journey. David Cobb talks about this journey and talks about this model. When you look at table 24.1 in the 6th edition of Billings and Halstead, you're going to see 5 main categories of learning theory. David Cobb's work, also known as experiential learning theory, focuses on the value of students having the hands-on experience in order for the learning process to actually happen. Sometimes that can be a bit of a challenge. We have to think about ways we can bring the clinical experiences into the classrooms with our students to help them learn. All right, so the first concept we're talking about is the relational aspects. Students, yes, they have competing priorities, and we have to help them focus, okay? So we're going to break down what focus should look like to help students achieve success. Now, we want you to also, now that you printed out your study worksheet, we want you to write down what is one objective, just one objective that you want to walk away with having a better understanding about at the end of our time together today. Again, knowing that we're focused on creating this inclusive, supportive learning environment for all of our students. And then next, we want you to write down Billings and Halstead, Teaching and Nursing. Again, we're in the 6th edition. You're going to focus on pages 18 through 22. Okay, so it starts out on page 18 talking about generational differences among students. Now, there aren't going to necessarily be any questions on the C&E exam related to generational differences. However, we do want to make sure that we are integrating a variety of teaching strategies in our classroom experiences that will connect with all learners across all generations and across all 4 of the different learning styles. The second focus we want you to have as you're talking and thinking through the conversation we're having today, because hopefully you're talking to your other colleagues about content that you're learning about or that you're receiving reinforcement about when you join us for our monthly or for our weekly snapshots. The next section we want you to look at in Billings and Halstead is page 30, box 2.1, learning strategies that correspond with VARC. VARC is a framework associated with the learning styles, right? We know there's the visual learner, the auditory learner, the learner that learns best by reading, and then we have the K for kinesthetic learner, which is that hands-on learner. All right, and then the next step I want you to take is to reflect. Reflect on, let's just use this past week. Reflect on the number of times, I want you to write this down, how many times did you connect with a student, okay, on a one-on-one basis? I connected with an amazing student today that was going through a tough time, and we talked about some strategies that could help her get through this very challenging time. Okay, so I want you to write down how many times did you have a one-on-one experience with your students? Learner diversity is a part of this learning journey that we go on with our students. Now, diversity can mean the way students learn. It can also mean their socioeconomic background. It can mean their gender. It can be their ethnicity, their race, right? There's so much diversity in our classrooms, and we want to be able to truly leverage the diversity in a positive way. So we're going to focus. What do we mean by that? F is for first. Keep everything first that needs to be a priority. That's the message to our students, and that's the message that we have to remember ourselves. And first and foremost, it's about meeting the learning objectives and helping students avoid those distractions that students are going to experience when they have competing priorities. So first, we want to focus on the learning objectives. Next is outcomes. What are those specific individual learner outcomes that we expect our students to be able to achieve? We want to help guide students to use that language as well, focusing on what is that one objective, what is that one outcome that they're going to walk away with by the time they exit our class for that day. C is for community. Thank goodness for our community. If you don't have a community that supports you, find one. This is essential for success. It's essential for our students to be able to get through nursing school because we know it's challenging. So encouraging our students to find their community. U is for understanding. Life can bring its challenges, and we all experience them at some point in time. How can we share with our students specific strategies that will not allow them to deviate from the policy and will also allow them to get through that challenge in time? So understanding is a really important part. Sometimes it's just pausing and listening, right? Engaging in active listening. Because students go through so many challenges and they have competing priorities or even shifting priorities, we want to help them come up with a solution that's best for them, right? We want to offer them suggestions, refer them to other resources, but ultimately it's about the student being able to articulate and advocate for themselves. So again, U is all about understanding where that student is in an effort to help them get through that challenging situation, which S is for situation. We want our students to come to the class and be focused. However, we know there are situations in their life that just doesn't allow for that. So what can we do? First of all, keeping our focus, right? Making sure that we are clear about the teaching strategies we're using for that day. We've already completed our lesson plan, and we know specifically how the content in the class is aligned with the textbook. So we're giving them specific page numbers or chapters to refer to help them have that deeper understanding of knowledge that we need for them to have, not only to do well on their formative assessments, but their summative assessments, their NCLEX, as well as providing safe patient care. That's what it's all about, right? So S is for situation. Our North Star is our student, right? We are focused on student success. That's what ultimately we all want. And we have to make sure we're demonstrating and role modeling those behaviors that align with our priority being helping students to achieve success. All right, so this is our thought-provoking question, and then we will end our time together for today. You have been hired as a nurse educator at a nursing program that is preparing for an upcoming accreditation review. Faculty morale appears low, policies are inconsistently applied, and course outcomes are not clearly mapped to program outcomes. As a new faculty member who wants to function effectively within the educational environment, what is the most appropriate initial action? Okay, so we have A, revise your assigned course syllabus to strengthen learning activities and ensure students are well prepared for the next exam cycle. B, conduct a systematic review of the institution's mission, governance structure, accreditation standards, and committee processes to understand how decisions are made. Or C, focus primarily on building strong relationships with students to establish classroom trust before engaging in broader program or institutional initiatives. All right, so here we go. I want you to take a look at this question, number one, and think about what is this question really asking me? And number two, what is it that I know for sure about content related to this question? You, again, are going to use Billings and Halstead, pages 18 through 22, to help you close your knowledge gaps and to have a deeper comprehension of concepts that we are referring to. As much as we want our students to listen to the information that we're sharing, and we want them to understand, have that deep comprehension of concepts, we also want students looking at the evidence. Okay, so this is why we are role modeling behaviors that we want you all to demonstrate with your students in the classroom. It's not enough just for us to memorize concepts, to memorize content, and expect to, number one, do well as a nurse educator, right? It's really hard to facilitate an impactful learning experience with our students if we don't have the skills, if we don't have the competencies to demonstrate that. And then number two reason is because our goal is that you will achieve that passing score on the C and E on your first attempt, right? We always want to do it one time. We want to take the exam one time, just like our students with NCLEX. All right, so here we go. If you chose B as the correct answer, you are correct. Give yourself a round of applause. All right, so let's talk through it. Well, when you look at the other two options, it's a little bit superficial, right? There's some really good elements that's included in option A and option C. However, it's more specific as opposed to a comprehensive answer, and that is exactly what the option B gives us. So how are you feeling about your knowledge of these concepts that we're talking about? Are you feeling a little lost? All right, so you would be a 1. Engaging in reflection and self-assessment is an important part of your nurse educator journey. As we're exploring ways to get better, we want to think about how far we've come, right? We want to live in the moment, reflect on opportunities, and also celebrate. Celebrate the accomplishment, celebrate when you choose the correct option. We want to take some time to celebrate those successes as well. Evaluation time is one that I do still get a little bit anxious about. But this is formative feedback. When we look at the end of course surveys, we want to make changes, right? We want to hear from the voice of our learners, our students, in an effort to help us get better. Now, it's only one data point, but it's an important data point that helps inform us about educational practices that we need to integrate, maybe that we need to remove altogether, and some we may just need to change. So when you're thinking about where you are, know that you have support, know that you have a community. Thinking about this focus framework is going to help us support our students on their journey towards success. We know that every student is capable of learning. Sometimes they just have to get some guidance from us to help them prioritize and to be able to get through that tough time. We hope this snapshot has been helpful. Reach out to us if you have any other questions. info@drsellarseducate.com. Make sure you go to our website and you can see all of the resources and support that we have available at drsellarseducate.com. We look forward to seeing you in the next snapshot and in a future program. Have a great one, everybody.